Hello everyone, my name is Robert. I'm a student at Nightingale College. Today I'm going to be performing a video skill which is administering IV fluid and medication. First things first, I am wearing my school ID and my school issued uniform. So first I'm going to do is perform hand hygiene, right? Hand hygiene, good. Now I'm going to put on my gloves. Let's put my gloves on. Okay. Now, I'm going to check the MAR. It's very important that I check the MAR. This is also part of the safety part. I'm going to be checking the MAR. I'm going to be checking for the physician's orders. The orders are 150 milliliters of normal saline, and I'm also going to be given 250 milligrams of amoxicillin with 100 mLs of normal saline. So that is this one right here. This is my 250 milligrams of amoxicillin mixed in with the 100 mLs of normal saline, right? And then also here is my, this is going to be my 150 mLs of normal saline, right? I'm sorry, my brain's stopping. Also, what I want to do is I'm going to be checking for the 6 rights when I'm done with checking the orders and also checking against the medication. I'm checking for it's going to be the right patient, the right medication, the right dosage, the right route, the right time, and the right documentation. Other means of insurance the patient safety is I'm going to be checking the IV fluid and the medication for the content. I'm going to be checking for if there's any expiration dates on the bag, making sure the medication is not expired, making sure that it was properly stored, making sure there's no rare discoloration to the bag or to the medication. Also, I'm going to be going in and checking with the patient, checking the patient's ID, 2 forms of ID. I'm going to check the patient's ID band, as at that time I'm going to have the patient verbalize his name, date of birth, and also, also making sure the patient has no allergies to amoxicillin. Very important, no allergies. So now that I got that part out of the way, I'm in the patient's room and I'm going to be going over my IV fluid, right? So both of these, my primary set and my secondary set, they both have the drip rate of 15, right? Drip rate of 15 for that one as well, right? So let me go ahead and identify these parts for you here, right? This is my primary set. It's a little bit different from the secondary set. So for the primary set, what we have here is we have the spike in, we have the drip chamber. We also have the Y port. Now the Y port is what we're going to use to actually hook the piggyback medication up to this side, but we want to always make sure that we wipe this with alcohol swabs and let it dry for 15 seconds. And then also over here on this side, we have the adapter end. Now the adapter end will go hook up to where the patient IV site, right? We're going to put that here on the side. And then also we have right here on my secondary tubing. My secondary tubing actually comes with some hooks, right? These hooks will be used if you don't have the space on your IV pole. These hooks will be used to actually hang the medication higher than the piggyback medication, higher than the normal saline fluid, right? Because you want to make sure that hangs higher. That's what these hooks are for. And then what we have here to describe what we have the spike in of the secondary tubing. We have the drip chamber. We'll fill that halfway up with solution. Also, we have the roller clamp on this one as well. And we're going to make sure that that's closed before we hook that. And then at the adapter end of this one, now this one will actually hook up to the Y port of the primary tubing, right? So now I got all that connected, or all that situated. Now I just want to go over the dosage calculations that I actually performed for this skill. What it is we have, as I said, the order says 150 mLs of normal saline, right? So I did the dosage calculation here. So what I did was I cross multiply the 150 mLs times 15 drops, and then I'm going to divide that by 60 minutes, and that will leave me with 2,250 divided by 60, leaving me, it will equal out to 37.5. But of course, we're going to round up because we're not going to be able to give 37.5 or count that. So we're just rounding up to 38 drops per minute. And then over here for the medication, is the order actually is for 250 milligrams of amoxicillin mixed in with 100 mLs of normal saline. That's going to run for over 15 minutes. The drop rate for this one, I multiply 15 drops times 100 mLs. And then I cross out the mLs, and that's going to run for 15 minutes, leaving me with 1,500 divided by 15. And the outcome for that one equals 100 drops per minute, right? So that's the way I'm going to set up my tubing, right? So I'm going to set up my tubing for that. And let's see here. So what I'm going to do now is I am going to remove the cap from my normal saline. Let's see here, the cap from the normal saline and the spike end of the primary tubing, right? And I'm just going to put that in here. Okay, make sure that's there. And make sure my roller clamp is closed. Let's roll it all the way down and make sure it's closed. All right, now what I'm going to do is I'm going to hang this right here on the IV pole. And it's important to make sure that these tubings, all your IV tubings and everything is going to be 30 inches above the patient's IV site, right? Very important to remember that, 30 inches above the patient's IV site. Now, what we have here with the drip chamber, we're going to set up our drop rate. I do believe it is 38 drops per minute. This is with the normal saline. So I'm going to remove the cap of the adapter in here of the primary tubing, and I'm going to just first I'm going to prime it, making sure that there's no air in the tubing. So I'm just going to release over a trash can, very important. Just going to release a few drops first just to get the air out. Well, actually, let me squeeze the chamber, get that halfway full. Squeeze that chamber first. Okay, good. Now let's go ahead and release just to get the air out of the tubing over a trash can. All right, so we're gonna let that out. Good, so let a little bit out there. Right, now I'm gonna use my watch and I'm gonna time it. And what I'm gonna be doing is I'm gonna be counting up 38 drops per minute, right? So what I'm gonna do here with, I'm gonna be watching that drip chamber and I'm gonna slowly release it, right? Release the roller clamp just to get 38 drops per minute. Okay, that is at 38 drops per minute. I'm going to close off the roller clamp and I'm going to close this in, right? Making sure, close that side. I'm just going to put this over to the side for now. And now also I'm going to do the same thing with the medication. I am going to make sure that my spiked end is still covered. For the amoxicillin. Now, it's important that the amoxicillin, I want to make sure that the labels are properly there. And as I said before, we want to make sure that on this bag, we want to make sure there's no expirations on that one. And also, I'm going to go ahead and making sure that we ensure that the start date is on there, the time that it started, and the flow rate that's actually there. We want to make sure we make it easier for the next shift to come on, and that way they can compare this with the doctor's orders as well. So I'm going to first take out the medication cap, right? And we're going to take off the spike end. We are going to go ahead and attach the spike end to the medication. Make sure that the roller clamp is closed on this one. And we're going to hang this medication higher, right? We're going to hang this one higher. And before we attach this to the Y port, we want to first make sure we're going to wipe off the Y port, right? For this one here. Wipe off the Y port, okay? And we're going to let that dry for 15 seconds. Then the air dry, right? That's going to, while that's drying, okay, 15 seconds. So that is dried. So I'm going to attach the adapter end of the secondary tubing to the Y port. Okay, making sure that's attached. Okay, now from here I'm going to also have to prime the first I'm going to fill up the chamber with the medication there, halfway filled. Okay, good. Now I'm going to prime this tubing as well for making sure to remove the air out of this tubing, out of the secondary tubing, right? So then this one we're just going to first make sure we let a little bit out to release the air or to prime it, making sure there's no air. Make sure we do that also over the trash can. Okay. And good. Now we want to close that. Now for this one, I'm going to be making sure that this one, I'm going to time it for 100 drops per minute, because this one's going to run for 15 minutes. The other one's going to run for 1 hour at 38 drops per minute, but this one's going to run for 15 minutes for the amoxicillin, right? So what I'm going to do is I'm going to go ahead and hold this over the trash can, and I'm going to go ahead and look at and watch the drip chamber. And I'm going to time that for 100 drops per minute. Let me make sure my clock is ready. Looking at my wristwatch, 100 drops per minute. And let's slowly release. Okay. Almost. Okay, that is 100 drops. Now I'm going to close that off, right? And then from there, I'm going to put the cap back on this one here, making sure that these are brand new sterile caps. Whenever I put the cap back on, we have the supply here. And I'm just going to put that there. And then also, before I attach this to the patient, once again, I said this have to make sure that it's going to be 30 inches above the patient's IV site or IV port, wherever the patient is. And then also, I want to make sure that before I connect it to the patient, I want to make sure that this one, the IV fluid is going to be put back at the rate that I set it for 38 drops per minute. And then I'm going to also confirm that the secondary fluid, the piggyback medication, is going to be higher than the IV, the normal saline. And I'm going to make sure that that one is set at 100 drops per minute. I would also make sure that I wipe off the patient's IV port before I attach the adapter end to the patient's IV port. And then from there, I'll go ahead and monitor the patient during this time when he's receiving the medication. I want to make sure I check the patient's vitals before he received the medication and then after, so I can get a baseline. And then I want to go ahead and clean up the area, and then take off my gloves and perform hand hygiene and document. All right, thank you very much.